Even though our country has made tremendous strides on the topic of racism, many people see it existing today. Many African Americans today still have to deal with being discriminated against on a daily basis, which can affect them psychologically in a negative way. In a survey done in 1990, 29% of whites viewed blacks as unintelligent, 44% believed that they were lazy, 56% said they prefer to live on welfare, and 50% felt they were more prone to violence. These negative stereotypes can lower their self-esteem greatly. There are many poor urban neighborhoods that are prominently black, and having a lower socioeconomic status makes one 3 times more likely to have a psychiatric disorder. Living in a poor urban neighborhood, most have to deal with a poor education and are surrounded by criminal activity. This leads to one having very low life satisfaction, which can then lead to anxiety, depression, and other psychological disorders.
Because sometimes when you have a mental illness, you feel so different. It's like you're not even, you feel so disconnected. Like I can't even feel like other people feel, When I would burn myself, the sound of the needle hitting my skin, I could hear my skin burning. It brings back that, okay, I am human, I am here because I can feel this pain.
I went to prison twice. Both times it was drug related. My first time going to prison is when they put all the labels on me. The psychiatrist will talk to you for 5 minutes and give you a diagnosis. And 9 chances out of 10, it's wrong. And you really shouldn't be there, because that's taking the guy that has mental challenges and placing him with the guy that's just a straight up criminal. And you know what's going to happen. It's going to be trouble.
Racism today is much more subtle and more destructive, insidious, and damaging to people's mental health. One area that is underexplored is how Black people's experiences with and perceptions of racism affect their beliefs about seeking treatment for mental health problems in general and, more specifically, for depression. Depression is among the most common forms of psychological distress for all women. A great deal is made of Black people's delay for treatment, but the insensitivity and racism they often encounter when they do seek treatment is seldom mentioned, nor is credence given to how their experiences with racism affect the therapeutic encounter.
Some mental health experts say there's a reason Black women often don't recognize they're depressed.
It's definitely something that hasn't been talked about in our culture, and so people don't know what the signs and symptoms of depression are.
Because it's unrecognized, depression often goes untreated. And some health experts say ignoring their mental health may be causing Black women's physical health to suffer, contributing to high rates of heart disease, hypertension, and diabetes.
And it has to do with, I call the body screaming. Somehow it has to get out. Something has to break down eventually. And so we are breaking down in numbers that are astounding.
Research on racism and mental health in sociology and psychology emphasizes African Americans' exposure and response to the stress of racism. Regardless of social class, African Americans report experiencing racist events so frequently that depression, tension, and rage about racism are the most common problems they present in psychotherapy. For Blacks, everyday racial stressors are significantly related to psychological distress, Essentially, racism can be the unintended consequence of daily discourses and practices that perpetuate and reinforce an oppressive structure of power. These offenses occur often, possibly thousands of times, to a Black person during a lifetime.
For Black and ethnic minority communities, most of the issues around mental health are the same as any community, which is the need for support, understanding, practical help. The bulk of the issues are the same. I think then on top of that, Black and ethnic minority communities have to cope with external racism, misunderstandings, services that maybe aren't as sensitive to their needs as they should be.
Well, my mental health problem started 20 years ago. I felt alone and frightened and insecure. And then my friends and my family didn't know how to help me, so I had to look for professional help. I think people in my community don't understand mental health, but there are more and more people now in my community that have got mental health problems, but they don't speak about it.
According to a report of the Surgeon General, formal mental health services are underused by all Americans. African Americans, however, are less likely to use mental health services, specifically outpatient services, than all other minorities. Research has shown that among Americans with perceived or actual clinical needs, white and Hispanic Americans were more likely to receive treatment than African Americans. Studies have found that African Americans rely on religious coping or the use of religious beliefs to adapt to stressful situations. Religious coping has been shown to partially explain disparities in mental service use. A recent examination of the relationship between religious coping and mental health utilization found that African American college students who more frequently utilize religious coping methods were less likely to utilize mental health services when experiencing significant depressive symptoms. These findings indicate that although religious coping acts as an important source of strength when facing stress, it can also act as a barrier to utilizing mental health services for those who could possibly benefit from such services.
Like so many generations of Black women, she turned to God instead.
We grew up in church, and when things were beyond what I thought I could handle, I'd pray about it.
Dr. Michelle Balamani understands the importance of the church to Black women because she's also an ordained minister. She spent her career trying to build a bridge between church and therapy, letting women know they're not turning away from God by seeking help.
I preach that God can heal in many ways. In the same way that you go to a doctor to get your leg fixed if it's broken, you can go to a therapist if you need one. You need to put your own gas mask on first so that if you're going to be taking care of all these other people, take care of yourself first so you can do a better job at it.
Now with her own.
In other parts of the world, mental health has got stigmas that people working in services here still have got to understand in order to make themselves more available. So sometimes it's not just about accessing services as such, it's about people within those services to be open to what mental health means to different people in different places. There's been a lot of attitude change. Belief takes a bit longer. There are people like myself, like our organizations, that are really willing to and open and working towards making people see the person and not the problem.